10 years ago, we really didn't have the endoscopic therapies that are available to us today. These therapies include ablation of precancerous mucosa by radiofrequency ablation. We're looking at cryotherapy, which is freezing the epithelium of the esophagus. And of course, one of the best studied endoscopic therapies, and the one which has perhaps had the best outcomes to date for early cancers, endoscopic mucosal resection, essentially polypectomy of abnormal areas of the lining. Oftentimes, we would combine an endoscopic mucosal resection with a radiofrequency ablation procedure. We would do the endoscopic mucosal resection to remove any irregularities in the lining, any nodules or lumps and bumps, and certainly any cancer we would want to remove by endoscopic mucosal resection. So we can determine a margin and also a depth of the specimen. The pathologist would tell us that. Once the lining has healed, we would follow the endoscopic mucosal resection with what is called a radiofrequency ablation procedure. This is commonly known as the halo procedure to much of the public. And the purpose of that is to basically treat any residual non-cancerous but potentially precancerous Barrett's esophagus. So we remove the cancer, we remove any lumps or bumps, and then we follow up with an ablative procedure to remove anything that could develop into a cancer in the future. These are all minimally invasive options that are all done in an endoscopic procedure by gastroenterologists. And in all of them, the patients go home immediately afterwards. They're relatively safe and well tolerated. So certainly, if you have precancer or cancer in Barrett's esophagus, you should seek consultation in a high-volume center where the surgeons perform a lot of procedures because surgical outcomes are correlated with procedure volume, and certainly where endoscopic therapy may be an option because if the center does not have expertise in it, it may not even be offered to the patient.